If you're debating between an implant and fillers for areas on the face like the chin, the cheeks, or the nose, these are my recommendations which may help make that determination for you between fillers and an implant. A good candidate for an implant would be, number one, if you're actually already undergoing a procedure, combining an implant will decrease the overall cost and the overall downtime as opposed to doing the two separately. Number two, if you are 100% set on having augmentation done and you know what the final result you want to achieve, then an implant would be a good option. Number three, if you need significant augmentation, like in the direction of projection or broadly across the chin and jaw region, you may be a better candidate for an implant. This category also includes people who may have like a congenital deficiency of the chin or the cheeks and seem to have struggled their entire lives with a sense of imbalance. Number four, if you have thicker soft tissues of the face or thicker skin, you may need a firmer, stronger implant to be able to support those tissues and to provide that final result that you're trying to achieve. And finally, number five, if you're healthy and fit, then you'd be a great candidate for an implant. So how do you know if you'd be a better candidate for a filler? Well, number one, if you're not 100% sure on the idea of augmentation, then fillers gives you this flexibility to kind of play around with the appearance. You can add a little bit more filler here, or you can even dissolve a little bit with hyaluronidase. Number two, if you're trying to just achieve a more subtle appearance, fillers may be a better option. Implants tend to create a little bit more of a dramatic effect, and so if you're just trying to have a softer appearance, then fillers may be able to help you achieve that. And number three, similarly, if you're just trying to turn the clock back by 5 to 10 years, fillers may be a better option than implants, which may have a tendency to be a little bit more dramatic and change certain features like the chin or the cheeks. Number four, if you're just not ready for the downtime or the aftercare involved with an implant, then fillers would be a good option. And finally, if you're not a great healer or not a great candidate for surgery in general, like if you have uncontrolled diabetes, if you're a smoker, if you have connective tissue disease, or even if you tend to keloid, you may want to consider fillers instead. So if you're still debating between fillers and an implant, you can always come on by Clear Lake Medical Spa, where we try to be as comprehensive as possible with all your options for facial rejuvenation.